So next, let's move on to other types of dental anomalies of shape. So we'll discuss here dens evaginatus, dens invaginatus, tarodontism, and dilaceration. So dens evaginatus can be defined as the presence of an extra cusp on a tooth. This cusp can not only involve enamel, but also dentin and pulp, making it a comprehensive anomaly. Interestingly, dens evaginatus tends to be unilateral, only affecting one side of the dental arch. The mandibular premolar is the most likely permanent tooth to be affected by dens evaginatus, but in anterior teeth, this anomaly is known as a talon cusp. So Denzi vaginatus has a prevalence ranging from 0.06% to 7.7% and is more frequently observed in individuals of Asian descent and Native American populations. Dens invaginatus is also known as dens indentae, and this is a developmental anomaly that occurs during tooth formation. It arises when the inner enamel epithelium, which plays a crucial role in tooth development, folds or invaginates inward into the dental papilla before calcification occurs. Take a look at the clinical photo of the right lateral incisor. Notice how the enamel folds in on itself, creating an atypical presentation here. So this invagination can vary in depth, and in severe cases, it may extend into the pulp. So here's a radiograph depicting dens invaginatus. So again, we can see that it is an infolding of enamel and dentin. So again, take a look at the radiograph on the right. This mixed radiolucency shows that in the lateral incisor, we can see the depth and complexity of the invagination, and it almost looks as if there's a tooth within the lateral incisor. Moreover, the maxillary lateral incisor is the tooth most likely to be infected by dens invaginatus. Another characteristic of dens invaginatus is that it's typically bilateral, unlike dens evaginatus, meaning that it may affect both sides of the dental arch. Remember earlier when we discussed microdontia? We mentioned that the maxillary lateral incisor is the most commonly affected tooth. Well, interestingly, the same holds true for dens invaginatus. Tarodontism is derived from the Latin word tauros for bull and the Greek term otis for tooth, or as we can say, bull tooth. Take a look at this image and see how the pulp chamber is very, very large here, and the tooth somehow looks like a bull. We can see how the root bifurcation is placed away apically compared to the molar next to it. So tarodontism is characterized by an enlarged pulp and apical displacement of the pulpal floor near the root apex. Affected teeth often exhibit short roots and canals with a lack of constriction at the CEJ. So diagnosing tarodontism typically requires a preoperative radiograph for accurate assessment. Tarodontism is typically an isolated anomaly, meaning that it occurs independently. And there are three types of tarodontism where we can discuss. So we have an hypotarodont where the pulp chamber is slightly enlarged and there's a mild apical displacement of the pulpal floor near the root apex. However, these changes are not as pronounced in other types of tarodontism. Next, we have mesotarodontism, which represents an intermediate stage between hypotarodontism and hypertarodontism. And finally, we have hypertarodontism, which is characterized by a significantly enlarged pulp chamber and a pronounced apical displacement of the pulpal floor toward the root apex. The tooth most likely to be affected by tarodontism is the mandibular molar. The final dental anomaly we'll discuss today is dilaceration. Dilaceration is an abnormal bend or curvature in the root of a tooth. This bend typically occurs in the apical half of the root. So one common cause of dilaceration is trauma, particularly in cases involving primary anterior teeth. Traumatic injuries such as intrusion, lateral luxation, or extrusion of primary teeth can affect the development of the underlying permanent tooth. The permanent maxillary premolar area is most likely to be affected by dilaceration. So diagnosing dilaceration typically requires preoperative radiographs for accurate assessment of the root structure. Dilaceration can pose significant challenges, especially to root canal treatment. The degree of bend can definitely cause issues in root canal treatment, making it very challenging. The bend typically occurs in the apical one half of the root.